Charming. Pet Guru. How to trick a cat to take liquid medicine, easy method in 2024. If you ever find yourself wondering about giving your cat liquid medicine, just know that I've been there too. The thought of giving medicine to my cat, especially with a syringe, isn't something I look forward to. But hey, don't worry. I've discovered ways to make it easier. Some methods even let me avoid using a syringe altogether. However, if I have to use one, I take a moment to get everything ready and add some tasty flavors to the medicine. It makes the whole experience more enjoyable for my cat. So, no need to stress about how to trick a cat into taking liquid medicine. There are options out there to make taking care of your cat in this way a bit easier for you and me. Different methods to give your cat liquid medicine? Dealing with cats and their medicine can be quite a challenge. Even if my cat is a bit stubborn, I know it's crucial to ensure he gets the medication he needs. If I find myself wondering how to give liquid medicine to my not-so-cooperative cat, one trick I've heard is to hide the medicine in his favorite food. But, if that doesn't work out, there are other ways to help my furry friend. Explore different methods and learn more about cat health, like dealing with cat poop issues or understanding black spots on your cat's gums. Mix the medicine with canned food. One approach I've considered is to mix medicine with canned food. It's like when you try to distract children, and my cat might not realize he's getting medicine if it's mixed with wet food. Of course, before trying this, I always check with my vet to make sure it's safe, especially if my cat is on other medications. When attempting this method, I make sure to use a small amount of food mixed with the medicine, ensuring my cat eats it all without leaving any behind. Number 1. Give liquid medicine in a syringe. When I need to give my kitty liquid medicine using a syringe, it can be a bit tricky. If my cat doesn't like taking medicine with canned food, I have to use the syringe method. Here's a simple guide to the steps I follow to do it right. Number 2. Prepare the medication. I start by gathering what I need and filling the syringe with the medicine before involving my cat. Being prepared helps make the process smoother and keep stress to a minimum for both of us. Number 3. Position my cat. I make sure my cat faces away from me during the procedure. With the syringe in one hand and gently holding my cat with the other, I make sure he's comfy in my arm to avoid sudden movements. Number 4. Consider a towel wrap. When things get tough, one method I might attempt is a towel wrap. This involves exposing only my cat's head while securely wrapping the rest of his body. Before resorting to this, I usually give it a shot without the wrap to gauge my cat's comfort level. In more challenging scenarios, enlisting the help of a friend for a blanket wrap can provide additional support. Number 5. Adjust head position. To simplify the process, I gently tilt my cat's head upward, grasping his top lip and gently pushing back his whiskers. Ensuring his head is facing upward toward the ceiling makes it easier to administer the medicine. Number 6. Gently insert the syringe. With care, I insert the syringe at the side of my cat's mouth to encourage him to willingly open it. This technique targets the back of the tongue, minimizing the likelihood of gagging. Number 7. Administer the medicine slowly. I take it slow and steady, delivering the medication into my cat's mouth. It's important not to rush this step, as squirting too quickly or too close to the front of the tongue might make my cat spit out the medicine. Number 8. Hold and count. After giving the medicine, I continue holding my cat's head for a count of 3, gently stroking beneath his chin to encourage swallowing. Keeping these movements gentle is crucial, considering the tenderness of my cat's throat. For really tough cases, different methods like an IV or injection might be needed, and checking with the vet becomes even more important. However, for most situations with my cat, these simple techniques tend to work effectively. Number 9. Cat's liquid medicine in wet food. When it comes to giving my feline friend liquid medicine, I've discovered a clever and stress-free method, mixing it in with wet food. Let me take you through the detailed steps of this cat-friendly process. Number 10. Prepare the essentials. To start, I ensure that I have the prescribed liquid medicine and a wet cat food variant that aligns with my cat's taste preferences. Understanding my cat's likes helps me choose a wet food that can effectively mask the medicine. Number 11. Precise medication measurement. Following the veterinarian's guidance, I carefully measure the exact dosage of the liquid medicine using a syringe or dispenser. Precision is crucial to guarantee that my cat receives the correct amount for effective treatment. Number 12, thoughtful wet food selection. Choosing a small portion of my cat's preferred wet food is a crucial step. I take into consideration the aroma and flavor profile of the wet food, aiming to make it irresistible for my cat and distract from the medicine. Number 13, thorough mixing of medicine and wet food. With a gentle hand, I introduce the measured liquid medicine into the chosen portion of wet food. Thorough mixing is essential to ensure the medicine is evenly distributed, making it more challenging for my cat to detect. Number 14, observing my cat's reaction. The moment of truth comes when I present the medicated wet food to my cat. I keenly observe its reaction, assessing if my cat easily accepts the disguised medicine. The enticing aroma and taste of the wet food play a pivotal role in my cat's willingness to consume it. Number 15, monitoring food consumption. Ensuring that my cat consumes the entire portion of wet food is non-negotiable. I confirm that my cat ingests the full dose, assuring the effectiveness of the medication. Close attention is paid to this aspect throughout the process. Number 16, considering flavoring agents, optional. In situations where my cat displays pickiness or hesitation, I consult with the veterinarian about incorporating flavoring agents. These additives can enhance the overall taste, making the medicated wet food even more appealing to my discerning feline companion. Number 17, consistent repetition. Consistency is key to successful administration. I adhere to the veterinarian's schedule, repeating the process diligently throughout the entire duration of the treatment. Number 18, consulting with the vet. Before proceeding, I always check with my veterinarian to ensure that the medication can be safely mixed with food. Their expert advice is sought to guarantee the well-being of my cat, and alternative solutions are explored if needed. This intricate yet effective approach of hiding liquid medicine in wet food achieves the desired therapeutic outcome and strengthens the bond between me and my cat during the medication process. It's a method centered around ensuring my cat's comfort and minimizing stress for both of us. What if your cat starts foaming at the mouth? There might be instances where your kitty reacts unexpectedly, especially after taking medication. But fret not, it doesn't necessarily indicate the medicine is harmful. Sometimes, my cat may foam at the mouth simply because he dislikes the taste of something. To mitigate this, I can attempt to place the medication on the back third of his tongue, making it less noticeable and reducing the likelihood of foaming. If I'm worried, consulting my vet is always a wise move. When I begin administering liquid medicine to my cat, I shouldn't anticipate flawless execution right away. It's a learning curve for both me and my furry companion, and things will improve with practice. If I encounter difficulties, I won't hesitate to seek additional guidance from my veterinarian. Conclusion. Ensuring your cat takes liquid medicine can be challenging, but it's essential for their health and well-being. Experiment with various methods to find what works best for your feline friend, and always consult your veterinarian for advice tailored to your cat's specific needs. Remember to be patient and gentle, as creating a positive experience around medication time can make the process smoother for both you and your cat. If you encounter difficulties, don't hesitate to seek professional help to ensure your cat receives the necessary treatment without unnecessary stress.